Hello everyone, today's video is another Q&A video, several different topics today, talking about probiotics, talking about NAD, intravenous kind of things you need to supplement with that, or maybe not, how to get lead out of the brain of a 13-year-old, and something about methylene blue. So as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So let's see, what do I have up here first? So yeah, there's a question that says, oh my goodness, my window's a little weird here. Okay. So it says, since NAD, intravenous NAD helps make ATP, does a person need to take antioxidants to offset the byproduct? So very interesting question. It's a good question. So just to give folks a little bit more background there, in case you're not intimately familiar with mitochondrial physiology, as many people aren't. So when we make ATP, adenosine triphosphate, the primary energy molecule for our cells, then that happens in the final stages of what's called the electron transport chain through an enzyme called ATP synthase. And the byproduct of that whole process is that there are free radicals that are produced as a consequence of that. So these like reactive oxygen species, reactive nitrogen species, basically the opposite of antioxidants. And so it's really important that these pro-oxidants are formed because it's part of the whole energy generating process, but we need to make sure that there aren't excessive amounts of those happening, or there aren't excessive amounts of those present, because they will actually damage the mitochondria. They can actually start to leak out into the cytoplasm, like the intracellular fluid, and start damaging other cellular structures, potentially including our DNA and ribosomes and our endoplasmic reticulums and all these different things, our cell membranes, etc. And so we really want to make sure that that doesn't happen. I liken a mitochondrion, the singular of mitochondria as a mitochondrion. I liken a mitochondrion to a combustion engine. So when you have an engine, you turn it on and it's burning gasoline, or let's say it's a gas engine, it's burning gasoline. It's like turning the conveyor belt, like the belt rather, that conveyor belt, man, oh man, I know nothing about cars. Apparently it's turning the belts that's ultimately leading to turning the wheels of the car to make it go. So the engine is doing work, but it's also creating exhaust. It's creating this byproduct that is very toxic, which is why you don't want to like turn on your car in your closed garage, because you'd be having a very bad rest of your day. So there's like toxic byproducts that are produced from the work that the engine does. And so it's important to, if we want the engine to do work, you need to make those toxic byproducts. It's just a consequence of that, but we don't want too much of that building up. So that's kind of what it's like. It's like, running a combustion engine, like in your living room. You need to have something to neutralize those toxic byproduct fumes that are coming off. Otherwise you're going to be, getting really sick and having a lot of big problems. So antioxidants are kind of like those fire extinguishers, if you will, or those neutralizers that are going to deal with those pro-oxidants that are a consequence of making energy on a cellular level in our mitochondria. So very good question of, okay, so I'm using IV NAD, presumably boosting up ATP production, and then does that mean I need to take more antioxidants to offset that? So it's a really good question. And the answer is to my understanding, there's no like official answer to that, like from the research literature, that we know definitively what the right answer is. What I can say from my own experience is that when I have patients who do various therapies that help them to feel more energized, so like they feel better, and whether that's changing their diet, whether that's exercising more, whether that's building more muscle as part of their exercising routine, whether it's taking a B vitamin complex, whether it's getting an intravenous Myers cocktail, whatever it happens to be, there are many different interventions that don't innately or that do not specifically involve taking antioxidants at the same time, and patients feel better, and there don't seem to be negative consequences from that. So in my opinion, if someone was boosting up their ATP levels through X, Y, or Z therapy, IV NAD or whatever it was, and they're not taking antioxidants, and if it was actually a really important thing to take antioxidants at the same time, then we should see some consequences of that. We should be seeing some signs that their body's, not feeling the best. They're like, oh, like my energy levels are better, but like, oh, I've got this brain fog, or like my energy levels are better, but I'm noticing that my my skin's getting dried out, or my skin's kind of like looking looser, or I'm kind of getting more like aches and pains on my joints, like various symptoms that would suggest that there are too many free radicals being produced because I'm just making so much ATP that like it's just not being it's the amount of peroxidants being produced are being um, it's excessive, and you're overriding or overcoming the antioxidant producing capabilities of the cell and the mitochondria themselves. So we just don't see that happening. So I don't think that it's intrinsically important to take antioxidants at the same time, at least based on what I've observed clinically. I'm not aware of any research literature that exists that is counter to that, but that's just me putting on my thinking cap and saying like that makes sense to me. And then with other therapies that boost up ATP based on how a patient's feeling, we can tell if they have more ATP because they have more energy. It doesn't seem to be a necessary thing to take antioxidant at the same time. All right, I did not really intend to speak on that for 5 minutes, but I had fun, so hopefully some folks had fun listening to that as well. All right, where's the next question here? Shoot, I had two on the same page here, and okay, well, there was one question. I'll just paraphrase here. Oh yeah, there we go. It was on a different screen. Okay, so it says, could you please tell us how to remove lead from the brain cells, especially for a 13-year-old boy who's having headaches for the last 5 years? Um, yeah, so I'm sorry to hear about the chronic headaches. So, when it comes to removing lead, obviously not giving any specific advice for this particular case, but when it comes to removing lead, hands down, in my experience, the most effective way to do that is using chelation therapy. So if I was not a naturopathic doctor that could do chelation therapy myself, and I was worried about lead in my brain or in my child's brain, I would find a doctor who was certified in chelation therapy and then go talk to them about getting some chelation therapy. Now, the question, of course, would be like, how do we know if there's lead in the brain? To my knowledge, there's no way to actually directly test for that, like outside of, I suppose, like a brain biopsy that was done to show lead, which of course nobody ever would do. So if there's elevated lead based on some lab test, and then there's all these neurological symptoms, we could put two and two together to say there's probably lead in the brain. But the question would be around like, what kind of diagnostic testing is done first, and then how much lead is actually there, and then, selecting the appropriate chelating therapy, whether it's, an intravenous therapy, or usually for kids in my practice, we usually use oral DMSA as a chelator because we just don't like poking kids with needles, because we're actually quite nice at my clinic and we try not to poke kids. Sometimes you have to, but we try to avoid it as best we can. If there's any follow-up questions to that, please feel free to post in the comment section below. And right. Okay, and then a question here about methylene blue. So where methylene blue, if it's combined with certain agents that boost up serotonin, it can potentially cause something called serotonin syndrome. So the question here is, does serotonin syndrome go away after discontinuing the conflicting med/supplements? And the quick answer to that is yes. Thankfully, serotonin syndrome is not a permanent affliction. So it's something that does go away after the agents that are jacking up the serotonin are taken away. So nice quick one. And then there was just a general question here saying, can you do a video on probiotics and which ones you like to use in your practice? So just very quickly, I don't know that I need to spend a whole video on it because I can talk about that pretty quickly. So there's three categories of probiotics, in my mind at least. There's kind of your standard probiotic, which would be, maybe there's four actually. Standard probiotics, which would be your Lactobacillus acidophilus, rhamnosus, your bifidobacterium, like these kind of standard probiotic blends. There are spore form probiotics like Megaspore Biotic or Core Biotic from Research Nutritionals. And then there are sort of like these miscellaneous ones like Saccharomyces boulardii, which isn't really a probiotic, but kind of gets lumped into the same category sometimes. And then the one that's, I guess, the fourth one, kind of the newer one in my armamentarium, but I've been using it a lot and seeing some good results with it, is something called Akkermansia muciniphila. So maybe that's in category 3 as well, kind of like little niche probiotics, if you will. Generally they have different indications. If someone has like an antibiotic-induced diarrhea or like digestive issues, standard probiotics tend to work the best in my experience. If we're trying to enhance the microbiome, that's where the spore form probiotics come in. Saccharomyces if we're dealing with yeast, or Clostridium difficile, and then the Akkermansia would be more if we're trying to instigate gut healing. Thank you for the questions as always. I will leave it there for now.